Welcome back, everyone. Today I'd like to show you how I create index models to fabricate temporary bridges. And by the way, this is part one of a three-part video series, so check out the other links in the description box. Before I show you how to create a quick index, I will show you two other options because the way you approach each case of temporary bridges will vary depending on the amount of time that you have available and the scheduling of the patient's appointments. First option is to take like a triple tray impression so that you can fabricate individual temporary crowns instead of a temporary bridge. Another option is use something like liquid dam, and we usually have leftover liquid dam from the Zoom whitening treatments. So this is perfect to basically create the fake tooth in the pontic area like you see in the video. And you want to do this in layers. So you put a little bit and then you cure it. This is not my favorite technique, and as you can see, I'm not very good at it. I think Gabby, it's a little bit better than me doing this technique, but it still serves a purpose, especially if you start that temporary bridge or like you're starting treatment at the same day, let's say, of the limited exam, and you're like, oh shoot, how am I going to fabricate this temporary bridge? Well, you would add this and then take your impression. And by the way, do not worry about that tooth getting stuck there. No, liquid dam, it's a great material for these things. You'll be able to flick it off. So just take your time and kind of take a few minutes to build that tooth as best as possible. And then one thing you want to double check is the patient's bite. So you don't want to overbuild that bite. In this case, I got kind of lucky because there isn't an opposing tooth, although the patient does wear a partial. So I do gotta be mindful. I don't want to be adjusting the bite forever after I make that temporary bridge. So I leave that space a little bit open and take my impression. The third option, and the reason for this video, is to take an impression of the teeth, which you will pour to make a diagnostic model. And you can either do a diagnostic wax up or put a little fake tooth like I'm gonna teach you so that you can create an index and be able to fabricate your temporary bridge. To start, you have here your model with the missing tooth. And what I actually went and looked for is a spare denture tooth. And usually every dental office will have a spare one because anytime you do a denture or partial, the lab will send you the extra teeth from the set. Another thing that every office probably has is expired composite. It just happens, or like expired flowable. And this is exactly what I'm using right now to sort of put the denture tooth in place. Ideally, just for full disclosure here, it's best to do this with diagnostic wax, but we didn't have that in the office. So I'm being creative and showing you guys how you can also be creative in case there's certain things that you don't have in your lab or in your office. You could also, by the way, with this denture tooth, I remember that I had to use an acrylic burr to kind of drill down from the bottom so that it's at somewhat the same height as the other teeth adjacent to it. And as you can see, it's very narrow compared to the space. So using something like that expired composite helps me fill in that space, and you'll see how I'll start kind of making it like a wider tooth that I need it to be. You could also use liquid dam to fill in the areas, but for this I don't so much like liquid dam because I want to be able to have some time to mold things around, and you'll see how I start doing it, especially to get really nice embrasure spaces. I don't think that I can really do that if I were using, like, let's say flowable or liquid dam. And I guess you can also use any other type of wax. I've done that before. Sometimes I need it, especially if I don't have enough expired composite. And you could also, like, if you don't have a denture tooth, you could just create one, like a little doughy thing with, again, with the expired composite, and then just have like something that is similar to a tooth, and then just put it there, and then just add the size like I've been doing it. As you can see, I'm still using the liquid dam to correct the void that I have in my model. That's horrible. You know what? Like, you can do this however you like. Add, put less. This is, again, a great opportunity to practice your skills. I think that the better you get, if you just practice in the lab, doing some lab work, I think it can make you better and probably a little bit faster when you're chairside making temps. I don't know, at least that's been my experience. And I actually enjoy lab work, just because for me, it's relaxing, and I just like to feel like I'm being creative. Take a close look at the embrasure areas. You don't want them to be as open as they look right now, so we gotta close them up a little bit. And you can always open them back up if the floss thread doesn't go through when you're trimming the temporary bridge. And I'm pretty sure I mentioned this already, but I will say it again. This is something that you have to prep for. So when the patient comes in for the limited exam, at that appointment, it's when you take your pre-op impression, and then you bring the patient back for the bridge prep, because you need to have some time to do the lab work, to make the model and your little wax up, so that it can be ready for that bridge prep appointment. And I'm pretty much done with my model here. It's just gonna reduce my chairside time significantly having this ready. You'll just fabricate an index out of this. Here's my index. And with that, I will fabricate the temporary bridge. And once I trim that temporary bridge and polish it and make it all beautiful, it's gonna look awesome. It's gonna be great for the patient. If you want to find out how I complete this temporary bridge, don't forget to watch part 2 and part 3. The links are below. But before that, go ahead and check out Gabby's anterior temporary crown video, because she goes in detail step by step how to make them, and the same rules will apply to any other temporary crowns that you will fabricate.